Good day. Let me share with you an interesting subject matter, but quite important and significant in a couple's life, and that's on natural family planning. In the context of what may be known to all of you, by statistics, 98% knew of at least one way, one modern method, while 94% knew of at least one traditional. And the use of modern methods was higher among women in the city or urban areas than among the rural inhabitants or population. If you're going to go by further statistics, and has not changed for a long time, 70% of married women aged 15 to 49 say they want to space future births or limit, but only two-thirds would have an implicit demand for some services that may be satisfactory. The remaining 26 were unmet need, and most of them don't even know what this is all about. In the context of natural family planning, it is not the way you think it is. It is planning or controlling pregnancy, pag-iingat, by timing the sexual contact during the fertile or infertile period of a woman's menstrual cycle. Ito in itself is very difficult, the woman's menstrual cycle. So one of the things na gagawin natin is I'll walk you through this. And this may be an indicative of certain manifestations or symptoms and bodily changes. Now, what is the advantage? Everyone knows that the advantage is it achieves or it controls conception without any use of artificial devices, and it is effective when it is consistently practiced. In other words, you have to know how, when, and is it going to work for both of you and your husband. What does it take? It takes an awareness of the body and the reproductive function. Hindi na siguro mahirap ito nowadays because everyone's concerned to how your body works and even how you achieve certain things. Ayaw nating magkasakit. So that's the reason why we're very much aware kung anong nangyayari sa katawan natin. Now, ang added advantage is that it enhances communication. You need to talk. You cannot just take for granted na he knows, she knows, and things of that sort. Another thing is there is decision making, especially when it involves sexuality and fertility regulation. And in that aspect, a very good part of the relationship is spontaneous during the safe period. The enhancement of communication is a very key factor. Again, pag may advantage, may limitations. One of them is willpower, cooperation, and commitment. That's why the couple should talk to each other. What is the advantage of what we're going to do? Is this really our endpoint? Ito ba yung gusto natin? Gusto nating magpalaki ng mga anak na kaya natin? Kaya natin sila na palakihin in the Christian way of giving them good education and caring for them and loving them, nurturing them. Is this what we want? And more or less, the commitment to be able to pursue this. The other limitation is not every day is a holiday. There will be days that you cannot just do it. And the effectiveness depends, of course, on the woman's fertility and the cycle. This is what makes it different. So the calendar method is at its best, highly relies on menstrual cycle. Kaya mahirap. That's why yung calendar or previously known as rhythm is very difficult because it relies on days of the cycle. Now, these are the things which is important for us on natural family planning. The determination of ovulation in the mid-cycle. So if you look at the days, walang naka-specify in this table, nakikita mo that there is sperm survival and there is ovum survival and there is what they call as an overlapping during ovulation. So if you're looking at the sperm survival and the ovum survival, most likely it's going to last for 3 to 5 days, about 72 hours for sperm survival, and about 24 to 48 hours for ovum survival. So it's important for us to determine it's not only one day. So ito yung basis for the biological basis of natural family planning. Now, what are the methods? Siguro ito yung interest natin. What we know previously is calendar method or rhythm. The other method is cervical mucus or Billings. The other is symptothermal. The modern day method of the so-called beads, which is actually what they call as standard days. And I will explain this later. And one that is, of course, espoused even by the natural family planning group and the pediatrician, as well as a group of obstetrician, rely heavily on the period of breastfeeding. Kaya ang tawag doon, lactation amenorrhea method. Let's go to this one by one. Calendar method is recommended for women with regular cycle. Therefore, if you have irregular cycle, it means that there is a longer period na hindi pagkocontact or abstinence. It works on a period that is very likely a 28-day or at least 26 to 28 days. Now, example lang to. If you're regularly menstruating na 28 days from the first day to the next first day, you now subtract 14. After subtracting 14, you take away 5 and you add 4. That will be the length of the fertile period. So if you notice, subtract 14, you got 14, of course. And if you want to know the fertile days, you subtract 5, and so that makes day 9 as the start of your fertile period and day 18 as the last day of your fertile period. So it already calculates the days of your fertile cycle. So in that aspect, you need to be able to complement with a regular menstrual cycle. Again, the basis for the computation, like what I said, was because of the sperm survival and the ovum survival. So you have this calculated to be the ovulation period, but you have to calculate that there are days of the lifespan of the sperm, which highly is 72 hours, but you have to add the probability that this cycle has a 2-day probability of having early ovulation. So that counts for the 5 days before the ovulation period. And if you look at the post-ovulation, you have 2 days for the supposed ovum lifespan or survival, and you have allowable again 2 days for the possibility of a late ovulation. So both ways, may 3 days and 2 days like what I mentioned in the biological basis, pero merong 2 days for early and 2 days for late ovulation. Now, this is the problem. Doktora, kung irregular ang cycle, hindi ko na pala pwedeng gamitin ang calendar method. Pwede pa rin, but may limitation. Kailangan alamin, find out, when is your cycle? So from the first day to the first day, that's a short cycle. For example, 28 yung shortest cycle, 35 yung longest cycle. So what do? You now subtract 20 from 28. So that's how you're going to do it. to be able to get the fertile days and subtract 10 from the longest cycle. So subtract 20 from 28 and subtract 10 from 35. That is why you get a very long fertile days of 8 to 25. This is one of the limitation of an irregular cycle. That's why calendar or rhythm was not very popular. Now, this is more popular because it has observable means. May nakikita, may nararamdaman. And this is the mucus discharge on the genital area. Now, the fertile type is usually clear, slippery, and it's very stringy. No, you can actually feel that it's stringy, egg white, clear, and there is feeling of fullness at the lower vaginal area or yung tinatawag natin na puson, and it provides protection to the sperm. That's why it's called fertile type mucus. The infertile type is opaque and flaky, sticky, they're not elastic, and it lacks that kind of slippery feeling. Yan. So if you are going to get this is the lower one is really your fertile. No? Ito yung ideal na fertile. Ito, infertile mucus, hardly can you find. Ito, hindi masyado because the tendency is it will break at some point. Ito yung more or less picture spectrum. So if you'll notice, this is going to be the days when you're about to ovulate, and this would be the most likely that you have a lot of secretion. And then again, for 1 to 2 days to 3 days after, that will allow you to still have some mucus na you can actually stretch it out, and then it becomes non-stretchy. Wala na siya. So these are observation. However, there is a commercial preparation. Ang commercial preparation na to was actually made possible through the so-called steps to conceiving. So these steps to conceiving, what I did was, I made this the other way around. This is especially for women that are working. So they don't have to be observing themselves because most of the time, when you get mucus secretion, it's at the beginning of the day, hindi towards the end of the day. So it is best taken during the area of the vagina at the beginning or on the beginning of each day. However, this Ovatel is a commercial preparation. I'm not advocating this. I just said it's actually a means to conceiving, and I used it in the reverse way. But it is saliva. So you take out the saliva in the morning. You take all of these observations every day, every morning, and you will notice there's a change. There is what they call an increased, parang mga dahon-dahon that kind of stems out from the middle, and this you will observe in the like a microscope or eyepiece. Anyway, this is personal. So ito, gagamitin nyo naman, you're the only one who's going to use it, and it's a saliva examination. So importantly, we have to do the so-called symptothermal method. These are changes in body temperature together with some signs and symptoms. So that's why it's called symptothermal. Tumataas ang temperature, yung biglang taas, yun ang coincidental with the peak mucus symptoms, which may indicate ovulation, and it may include swelling of the breast, sensitivity, and a dull pain in the abdomen. And this might, of course, herald abstinence after the shift or the peak. So this is how it looks. If you're teaching natural family planning, it is best to teach them also how to do a graph of their temperature curve. So this is what they call as a thermal shift. Ito yung dangerous period where you need to be careful. And this is how the entire thing looks like. So that's why it's called symptothermal. This is only temperature, but you also observe the cervical mucus. So these are the explanations of the mucus, whether it is white, it's stringy, it's opaque, it's dry, and the others are symptoms of the patient. So that may include the time of your fertile days. This is very important. I'm often asked this question, Doktora, pag pala nagbe-breastfeed, protected? In a way, yes, because of the hormonal change, yung protection ng breastfeeding, yun din yung protection mo against the ovulation time. However, it's best that they are advising, it's best to also observe mucus. So pag ang mucus mo all throughout, ganito, most likely, hindi ka nagme-mens, hindi ka rin nag-ovulate. So, for 6 months, likely, and now the recommendation is to do it at longer than 6 months. This is one standard method using beads. This is kind of tedious. Most of these were taught in countries that don't know how to read, they don't know how to count, hindi nila alam paano mag-calculate ng araw ng kanilang fertility. At the same time, most of them live on areas without electricity. Kaya matatawa kayo, these beads actually glow in the dark. No? And this is the actual fertile day. Now, if you look at this is applicable to 26 to 32 day cycle. So again, may limitasyon. Hindi pwedeng gawin kahit na anong araw ng cycle. It has to be within 26 to 32, but comparable 95 or higher yung pregnancy rate. Now, how do you do that? There is a band, ito yung kumbaga ito yung first day of menstruation mo and these are your menstrual days. The white bead represents the days when a woman can get pregnant or the so-called fertility days. So yan. And these white beads in those countries where this was experimented, they glow in the dark. The brown beads are again your infertile days and it's the time that the woman cannot get or the probabilities will not get pregnant. Again, you have to move the beads. Pag ganyan siya. So may specific beads, hindi lahat ng beads. Hindi siya parang rosary beads. They have an edge because there is a way where you're going to move this towards this direction. So there is a smaller part and around that part, this is how it goes if you want to use this so-called standard days method or the beads method as the way for a 26 to 32 day cycle. Again, shinorte nila. This method was experimented in the reproductive center of Georgetown University. I was fortunate to be able to be the first one when they came to the Philippines. This was taught to us. It's just a 2-day questioning. So if you make a note na may lumabas sa'yo, and yes, so don't have contact that day. If they are going to have a question and the answer is no, also take note if there are secretions yesterday. And if the answer is yes, they can still get pregnant. But if the answer is no, not likely today. So most likely you have to ask the so-called question by 2 days. May today and May yesterday. So again, this is a point where you have to analyze. These are meant for women that know how to take note na alam nila kung anong nangyayari sa katawan nila. So again, the point that we're trying to say, using natural family planning to control birth is actually non-procreative. True, but contraception in the sense that you are preventing something that is going to come out of a natural relationship between a man and woman is anti-procreative. So that is the so-called ethics in family planning. So if you're using natural family planning method, this is just to control birth, but it is the so-called non-procreative. So hindi lang mape-pregnant. But if you use a contraceptive method, it is against procreation. So those are the terms that they use for the ethics in natural family planning. This was really taken from a famous author, Dr. McManaman. And the last thing that I will tell every one of you is, as doctors, we have the obligation to counsel our patient. It is important that we have to know how to help women and our patients in the most feasible way that they can do it, but without taking in all the side effects. And I like this quotation from Ernest Hemingway: "For whom the bell tolls, it tolls for thee." The call is on us, and the call and the responsibility falls on our shoulder. Thank you for listening.